There's nothing like feeling, no matter how big our months were at Bernal Rehab, whether we did 120, 130, 150, 180K months, every single month you're starting over. Every month you're starting over. It's freaking brutal, right? It's like the minute December 1st starts, like, okay, we're starting over again. And it's just like, gosh, man, I have to make sure I'm churning in enough visits so that we can hit payroll and we can have profit and we can do this and do that. So that's the reason why I truly believe memberships is the way to go.
This is Secrets for Success.
Welcome to the Secrets for Success podcast. I'm your host, Greg Todd. Thank you, as always, for joining me. Today, I want to talk memberships. I believe you guys need to move into a membership model. It is such a great model, and I think it works so well. Whether you're insurance, whether you're cash-based, whether you're online, memberships are the way to go, and they're so easy to put into play. And so that's what I want to talk about, why I believe memberships is the way to go. Let's talk about how to start a membership, and let's talk about the way that you present it to your clients. Okay, so we'll use today's episode to hit those things. All right, so why do I believe memberships is the way to go today? Okay, let's talk about a couple of things that are happening. I'm sure you have seen what is now happening with the big, beautiful bill. Okay, the big, beautiful bill is going to now have 24 million people not have insurance. Okay, and these 24 million people that are not going to have insurance, let's talk about them. These are not rich people. These are, for the most part, broke people. These are people that barely could afford insurance, and their subsidies for insurance are going away. So that means that they're not going to have insurance. I would say of the 24 million, the majority of them are not going to have insurance anymore. Okay, so what is going to be the alternative for them? Cash pay is not going to be the alternative, because cash pay is much more, right? They can barely afford their $10, $15, $20 copay. So how are they going to not afford your $180, $200, $225, $275, program, or your per visit? Like, it's not going to work. Okay. So I believe that because of the subsidies going away with the big, beautiful bill, I think that we're going to see a huge wave of people that need your services or need some version of your services, but they just can't afford your traditional one-on-one in-person rates. So I think memberships are going to be a huge thing for those people. I think also for cash pay, look, the economy is getting tighter and tighter and tighter. And when I'm doing a cash pay visit of $225, $250, $275, some of you upwards of $400. I mean, people might do it one time or two times, but like, people just don't have the money to be able to say, all right, let's just kind of see where this goes. I'm just going to keep on coming. And I'm sure you all are feeling it. I'm sure you're feeling that, you having a 9 to 10 visit plan of care as a cash-based provider, now you're barely able to get 3 or 4 visits out of it. I mean, that drops your business by over 50%. So I just don't feel like cash is the way to go. People have an allotted amount of disposable income, but it's an allotted amount. And when there is a membership, someone can say, okay, I know I have this as my disposable income. I know what it's going to cost for this every single month. I can now allocate that, and it's not going to be a surprise number to me. It's not like, oh my gosh, I didn't realize I was going to do 9 visits with a therapist. No, the membership is this price, and then that's it, right? I think also it creates a level of security for people, knowing that, look, you're part of our membership. This is our monthly membership. You're going to be able to get this amount, whether you use it or not. And it gives people a sense of security that I'm not going to overextend myself with regards to my health budget, because I know what the actual fee is, right? And then the cool thing about a membership is that that, yes, some months they're going to use it, some months they're not going to use it. But either way, for the business, it creates steady income month over month over month. Man, there's nothing like feeling, no matter how big our months were at Bernal Rehab, whether we did 120, 130, 150, 180K months, every single month you're starting over. Every month you're starting over. It's freaking brutal, right? It's like the minute December 1st starts, like, okay, we're starting over again. And it's just like, gosh, man, I have to make sure I'm churning in enough visits so that we can hit payroll and we can have profit and we can do this and do that. So that's the reason why I truly believe memberships is the way to go. Okay, now, how do you make a membership in minutes? Well, this is one of the mistakes that I made when I initially started memberships. I thought that if we put everything possible in it, it would make it more desirable. But the reality is that less is more. Less is more. What people are looking for today is people are looking for answers. That's what they're looking for, right? A membership is never going to replace you doing a manipulation on a client, right? You being able to crack their L4, L5, okay? Or you being able to, do some type of mobilization to their shoulder, right? It's not going to replace that. But what it can do, especially for people initially, is it can create clarity, which is what you're doing to people on the first, second, third, fourth times that you're seeing them. You're giving them awareness. You're giving them methods, and you're giving them solutions and hacks to how they can actually manage whatever it is that's going on with them, physically, right? And that's what people are drawn to in the beginning part of a membership. So with that said, how you set the membership up, don't put hardly anything in there. What you do is you set the membership up where you're just giving people a way for them to be able to have office hours or clinical hours with you. That's it. Okay. And you're positioning it to where, look, if you do these clinical hours with me, on the clinical hours, I am going to answer questions like you are in the clinic. And I'm going to give you the clarity that you need so that you can take the next steps forward. And sometimes you'll be able to take care of that yourself. Sometimes, you might need additional help and assistance, but I'm going to give you the tools that you're going to need in order to be able to execute that out. And that is so powerful for people. I think there's many different groups of you that listen to the Secrets for Success podcast. And so I'm going to give you a few different examples of how I've done this with certain groups of you. All right. So let's talk about my pediatric people. A lot of peds people, one of your biggest issues that you all have is that you have waitlists. And the reason why you have waitlists is because you are taking parents and kids insurance. You are seeing people in a one-on-one format because of just the nature of your business. And because of that, it does create, for many of you, a massive demand, and you have short supply, right? And so because of that, there's a lot of people that are on your waiting list and they're just waiting to be seen. Now, the reality is that if they could be seen by somebody else, you're not that good. Okay. I mean, you're good, but they would use somebody else, right? But a lot of them don't even have a choice. They got to just wait for you. So I think that you could sell people on a membership of people that are calling that right now you're putting them on a wait list and you're not making any money at all from them. Instead, put them in a membership, take the hours that your clinicians are slow, which is probably usually between the 11 a.m. and 3 p.m. time before kids get out of school, and then just allocate those times to be clinical hours. The parents are not in school. The kids are in school. Even though you're treating the kids, you're talking to the parents because the parents are the ones that have to implement whatever thing it is that you want them to do. The parents are the ones that want the aha. They're the ones that want the clarity, right? And so that's when you do your clinical hours. And that's all you need to give them. You don't need to give them a bunch of videos. You need to give them a bunch of audio trainings. You don't need to give them a bunch of guides. All you need to do is just give them a clinic hours time for them to be able to ask questions. Once they ask the questions and you answer those questions, and you start to see that these questions are being repeated over and over and over again, that then gives you the content that you can actually have as on demand eventually inside of your membership. Okay. And the cool thing is that as you're answering the questions, a lot of times you're answering them on Zoom. You can use the Zoom transcript to be able to turn those answers into other systems and frameworks that you can use. So it can be turned into guides. It can be turned into ebooks. It can be turned into checklists, turned to a lot of different things that parents could use in just a different format to basically get the same answer that you gave them on the call. So it turns a lot of your content, which is what you're getting through the Q&As, into additional assets that you can use for your clients, right? So that's how I would use it with a PEDS, client, all right? Let's talk about like a pelvic health, right? Right, pelvic health, if you are seeing the majority of your clients via, a traditional, way, right? You can use memberships as a way to be able to say, listen, if you commit to this treatment, that we're doing, And the way that I'm doing the treatment is we're going to be doing a certain amount over this period of time. But then after that, I want to make sure that we do maintenance stuff with you so that we don't lose any of the progress that we made. And then inside of your membership, you're telling them that besides doing that, we're going to be working with you to get you to the goal, but then we're going to continue to work with you to maintain that goal. And we're also going to give you different tools and things that you can use outside of what I'm doing with you to be able to amplify your results and to be able to speed up and accelerate your results. And so by us doing that, you can give them now wands, you can give them creams, you can give them gels, you can give them lubes, you can give them different things that they can use that's going to help them get to the thing that they want to get with you. Okay, the result that they're looking for. Okay, so that's one way that you can do it in the pelvic health world. So I gave a peds example, I gave a pelvic health example. In orthopedics, which is like what my clinics have been, the way that we use memberships is we actually have the top part of our pyramid, which is the success path that our clients are going on, and we said, look, the goal is for you to get to the point where you're active and you're feeling great and you're not thinking about your injury anymore. Like you're really focused now on just building a better version of yourself. And so our memberships are more in line with doing fitness stuff. So we would have like circuit-based training that people would do. We call it TheraFit. It's fitness based off of therapeutic exercise, and we did it in a circuit-based format. So our memberships are more around going into a higher level of fitness and no longer doing therapy, but we're doing the fitness based off of exercises that they're used to. So it's therapeutic exercises, not using any massive, squat racks and, just kettlebells. Like they're using things that they're very comfortable with, bands, regular weights, et cetera, et cetera. So that's how we set it up. So there's many different ways you can set up the membership. And I hope that helps you guys. And I really believe that a membership is a great way to be able to cater to more people as we go into 2026. Now, I will say there's one other way, and that's the online way. Many of my clients, they are in the online space. And when you have so many things that you want to give to people, you can take some of those things out and just use it as a membership. I just had this with one of my clients. They had this massive membership that was like their core membership, but they were looking to now bring in more clients into their world. So what I said to them is, hey, why don't we take one piece of your membership out? Just tell me the one that people are using the most. So they said the fitness part is what our clients are using the most right now. I said, how many people do you have in that? They're like, well, we have about 20 to 25 people show up for every one of our fitness classes. I was like, all right, so why don't we do this? Why don't we just take that one piece out of your membership, and why don't we turn this into its own little mini membership, or like its mini offering? And so I said, just mail that out to your list. So they mailed it out to their list, and over 3 days, they got 119 people to join that one little piece of their membership. And so that's the thing. Like they use that one little piece to be able to now move people and get people reinvigorated into their world. And then at the end of it, they can now sell them back into the membership. And so there's just so many different ways that you can do this. I feel like it's very cost effective, super affordable. It doesn't get people any sticker shock. It lets people know that I'm going to be getting this result. It also gives people the ability for them not to just have treatment with you. You can give them other things that can help them with the results, and it stabilizes out your business. So I'm highly recommending for you guys to start memberships. Use that in 2026 and beyond. I really believe memberships is the way to go. I hope you guys enjoyed this episode. Till next time.